pressure is the pressure of the blood within the arteries. It is produced primarily by the contraction of the heart muscles. The measurement is recorded by two readings. The first is the systolic pressure. It is measured when the heart contracts and is the highest. Secondly, the diastolic pressure. The diastolic pressure is measured before the heart contracts and at its lowest. The normal reading for blood pressure measurement is 120 for the systolic and 80 for diastolic. A patient is considered hypertensive when the blood pressure measurement is above the normal range, while a patient is considered hypotensive when their blood pressure measurement is below the normal range.
These are the parts of sphygmomanometers. Firstly, this is the hand bulb. This is the air release valve. This is the tubing. This is the handcuff. This is the knob. And lastly, this is the mercury gauge.
Firstly, we have to roll up the patient's sleeve to expose the arms and the forearms. Make sure that you ask the patient permission first. Okay, next, in the blood pressure measurement, first we have to find the radial pulse to know whether the pulse of the patient is normal or not. To find the radial pulse, we have to palpate around this area where the radial artery located, and then place either 2 or 3 fingers here for 1 minute. After we have measured the radial pulse, we may now proceed with putting on the handcuff on the patient's arm. Okay, the handcuff must cover at least 80% of the arms, and this tube must be parallel to the brachial artery. Okay, next we have to locate the radial pulse once again and inflate the cuff by squeezing this bulb until the radial pulse can no longer be felt to provide estimation for our systolic pressure. Okay, after the radial pulse can no longer be felt, deflate the handcuff and locate the brachial pulse, which is located over here. After we have located the brachial pulse, place the stethoscope at the antecubital fossa. Then, inflate the handcuff to a pressure of 30 mm mercury higher than the estimated systolic pressure. Then we have to deflate the cuff slowly and note where a minimum of 2 repetitive tapping sounds are heard. So that is the first systolic pressure. Continue to deflate the handcuff slowly until the sound disappears. This is the diastolic pressure. After obtaining the reading, remove the handcuff from the patient. And then don't forget to switch off the knob as a precaution. Finally, lower the patient's sleeve and don't forget to thank the patient for their cooperation.